I don't think I need any further introduction, thank you. You're all taking me back a little bit way back to my dissertation, which was on parenting and child depression. So I'm excited to talk about this topic with you today, and I'll try to go relatively quickly so that we have plenty of time for discussion and questions at the end as well. So as Brianna mentioned, I'm a child psychologist both here at MGH and next door at Shriners for children. Here at the hospital I work mostly with kids who have medical illness and other concerns, and then I do have a small private practice out in Concord where I live, where I do mostly neuropsych assessment. And I am also the mom of 2 boys, 12 and 6 years old, so have the personal parenting experience as well, though we're still approaching the teenage years, and I'll be talking mostly about teenagers today, but we'll talk about younger kids too. Rapidly approaching the teenage years. A 12-year-old sometimes feels like a teenager. So I have nothing to disclose as far as this particular talk goes. And I thought we'd just start really quickly with some facts about depression, which also sort of illustrate a little bit why we'll be talking mostly about teenagers, but we'll talk about younger kids too. So it's actually only about 1 in every 50 prepubertal children who struggle with clinical depression or clinically significant depression, which is mostly what we'll talk about today. It's actually 1 out of every 5 teenagers who struggles with clinical depression. So you can see how quickly the odds increase as you approach adolescence for the onset of depression. And I think that a lot of what we'll talk about today is helpful for parents of younger kids too, in terms of thinking about what to look for and sort of how to maybe protect your kids, particularly if you have, say, a family risk of depression. And we know that depression is associated with a lot of negative outcomes for kids and teens, including school failure, substance abuse, bullying or being bullied, eating disorders, and suicide. So the other thing too, of course, is that teen depression can be mistaken for kind of normal teen angst, and it can be really confusing to sort of figure out, and that's a lot of what we'll talk about today, that a lot of the behaviors that you sort of think of as being a typical teenager, moodiness, anger, social withdrawal, at least from family, could actually be signs of depression. But how do you know? And the answer is sometimes it's a little bit tricky, so we'll talk about that too. And obviously teens may not ask for help. They may not even know to ask for help. They may not know whether or not how they're feeling is normal or not. And so as parents and caregivers and caring adults, we sort of need to know what to look for and when to intervene, and I think even more importantly, what's not up there is how to intervene. What do you say if you're worried about your child or teen? And I'm going to talk a lot about that today, because sometimes I think as parents we're just struggling to find the words. We have the concern of what do we say, how do we approach this, what do we do? And certainly depression can go along with other concerns. So some of you may be here today because you have a child in your life who's struggling with anxiety, or maybe with ADHD or a learning disability. And depression can be comorbid or coexisting with a lot of other concerns, probably not surprisingly. If you're really struggling in school, or you're struggling socially, maybe because you're on the higher end of the autism spectrum, then that could certainly lead to feelings of depression. So what is depression? What are the signs and symptoms in kids and in teenagers? What does make it different from sort of typical teenage angst? What are some of the symptoms? How do we distinguish it from being a teenager? And does it matter? Should we be worried about distinguishing it? And the answers are, it can be tough to distinguish, and yes, sometimes it does matter. So depression includes depressed mood, but for a formal diagnosis of depression, you have to have a sad, empty, or irritable mood lasting for at least 2 weeks. And the other thing that sort of distinguishes clinical depression from a depressed mood or a sad mood is that the depressed mood is accompanied by cognitive thoughts or somatic physical symptoms that affect functioning. And so family practitioners are taught, anybody in the room might know your sticky caps, you might remember that, which is kind of just a shorthand for remembering what some of the more somatic symptoms of depression are. What are the other things you're looking for in addition to depressed mood to make a diagnosis of depression? And this applies for adults as well as children, but we'll talk more about children in a minute. So CAPS stands for sleep. So is there a disruption in sleep? Is the child or teen sleeping too much or too little? Are they suddenly having trouble falling asleep or staying asleep or waking really early or sleeping excessively? Has there been a change in interest? Are they less interested in things that they used to really enjoy? Or they'll do them, but they're just not enjoying them as much, not wanting to be around favorite people as often. Guilt, which in kids can look like low self-esteem or expressions of guilt, and we'll talk about that in a minute. Energy, just feeling tired all the time or not having energy to do the things they used to like to do. Concentration, and that one would show up in school, right? So all of a sudden in a kid who generally has been a good student and not had trouble, they're increasingly having trouble concentrating and focusing for schoolwork. Changes in appetite, and that, like sleep, can go either way. It could be more or less. It could be less hungry, or it could be suddenly more hungry or sort of seeming to eat for comfort, right? Snacking a lot. Or weight gain or loss might be a good sign. And then psychomotor agitation or retardation, that's sort of suddenly slowing down. It's taking forever to do things in a kid who used to be on top of everything, and that could go along with changes in concentration, so suddenly seeming really forgetful and sluggish and just having a hard time getting stuff done. Or it could be more kind of anxious, agitated, pacing, maybe around homework time or that kind of thing. And then certainly suicidality, for which you'd be seeking immediate help, and we're going to talk a little bit about that too. Kids can be a little different, right? This was all of what we know about depression started in studies and understanding of adults, and then sort of was extended downward into teens and kids. And we know that it can look different in teens and kids, and particularly for that first item, that sort of sad, empty, or irritable mood. Irritable being the key word. A lot of times for kids, depression is marked more by increased irritability than it is by sadness and crying and that sort of thing, although that could be the case as well. And I'm sure many people in the room know there's a lot of research on and debate about bipolar disorder in kids. And bipolar disorder is not what we're talking about today. We're really talking about depression today. Bipolar disorder is marked usually by periods of depression followed by or subsequent to periods of mania or excess of energy and interest in other symptoms. And because kids with depression so often present as irritable, or maybe with that psychomotor agitation, it can be a little bit tricky to figure out. And in the newest diagnostic manual, I forgot hopelessness and helplessness, I'll come back to that. But in the newest diagnostic manual for psychiatric disorders, they've come up with a disruptive mood dysregulation for kids 12 years old and younger. So this is really more for that childhood depression piece, where it's marked by persistent irritability and frequent episodes of behavioral outbursts or tantrums, sort of out of the norm, out of the developmental norm, out of the norm for that particular kid, lasting 2 weeks or more, again, and if they can be given this diagnosis without having all of the symptoms of clinical depression and treated for this, and with the hope that it's preventing the likelihood of going on to develop depression or anxiety full-blown in adolescence or later on. And I did skip over hopelessness and helplessness, which is, I think, another good key to kind of keep in mind when you're trying to figure out, is this really depression? Is there a sense of hopelessness that nothing is ever going to get better, nothing's ever going to go right for me, everything goes wrong for me, all my teachers hate me, none of my friends want to hang out with me anymore, and you say, well, it's just a tough year, it's going to get better. No, it's never going to get any better, and there's nothing I can do to make it better, which is that helplessness sort of feeling. And another good way to sort of distinguish between clinically significant depression and more sort of depressed mood, which is still concerning and we'll still talk about, are the two P's. So persistence and pervasiveness. Is it persisting over time in spite of changes around them? Things are objectively going okay or getting better, but their mood and behavior are persisting. And pervasiveness, I think, for me, is key. Like so many of the other concerns in childhood, including ADHD, we don't diagnose ADHD if a child is only inattentive and hyperactive in one setting. right? We only diagnose it if it's happening in more than one setting, if it's happening at home and at school. And it should be the same for clinical depression. They may be able to rally at times and seem okay for a little while, but really they're showing depressed mood, not just at home, not just when they're with a particular friend group or confined to particular people or situations. It's a little more pervasive than that. So these are some signs of what might all that look like in a kid or in a teen, because it might not look the same as in an adult. So we talked about that already, that a lot of times it's marked by irritable mood. It could be crying easily and often as well. The loss of interest and withdrawal from friends or family, becoming more isolated, spending all their time in their room, not doing things they used to like to do. Relevant to that one, and we can talk more about this, is the importance of monitoring social media too, and because whether are they withdrawing from everything, are they withdrawing from spending time with friends and from social media, or are they withdrawing but they're still on social media, something going on socially that's impacting their mood. That can be really helpful to understand a little better. And in terms of the appetite and weight gain and loss, you also want to make sure that kids are staying on their growth curve and continuing to gain weight the way that they should be expected to do too. Changes in sleep we talked about, but it might look kind of confusing. You might think, well, he's having a hard time falling asleep because he's in his room on his phone all night, or he's watching TV, or he's watching Netflix until 1 in the morning. So that's why he's not sleeping well. Well, maybe, but if you're also seeing increased irritability and social withdrawal and change in appetite, and that's going on, well then that's more red flags. And you want to think a little bit more about that. Is it chicken and egg question of what's kind of keeping him up at night? Or suddenly taking naps. In the afternoon, homework doesn't get done because you come home and find her asleep, and she's been asleep for 2 hours, and she wakes up and maybe has a little dinner and then goes back to bed. That sort of agitation piece, it could be, I talked about that, taking a long time to complete things that used to be quick to do, pacing, more anxiety, kind of hard time sitting still in a kid who hasn't had those problems before. We talked about that withdrawal. I think social withdrawal is a big, big red flag for kids who otherwise have been socially outgoing and engaged with friends. This kind of relates to the hopelessness and helplessness, making critical comments about themselves. Well, I'm just stupid, I can't do this. I can't do anything right. That kind of like global, it's spilling over into everything. Everything's just bad and negative all the time. It's pervasive. So making critical comments, having more behavior problems, being really sensitive to rejection. Also where social media can come up again, and we'll talk about that in a second. Decline in performance in school. A lot of times in teens too, depression shows up in physical and somatic complaints. Frequent headaches and stomach aches are always worth just pursuing a little bit more and asking more about and figuring out. A new onset of substance use, marijuana, alcohol, especially if it's alone and not with friends, that's a red flag. And definitely if you're finding them writing about death, preoccupied with death, giving away favorite belongings or making statements like, well, you'd all just be better off without me, that's cause for concern. So I want to spend a couple minutes talking about suicide because it is important. It's the second leading cause of death for children and teens ages 10 to 24. More teens and young adults die from suicide than from a number of medical and other concerns combined. Each day in the US there are more than 5,000 attempts. And 4 out of 5 teens who attempt suicide have given some sort of clear warning sign. So remember, attempts don't mean completed suicide. And one of the biggest misconceptions and myths about suicide is that if we talk about it, they'll be more likely to do it. When in fact it is exactly the opposite. If your child is depressed, we need to talk about it. And if we talk about it, it's less likely to happen. And there are ways that you can talk about it and ask about it in kind of developmentally and age-appropriate ways, and we can talk more about that. But just as some examples, I'll often say to kids, have you ever thought about doing something to hurt yourself? And even in their understanding of that question, you can tell really quickly, right? So, you know, a 9-year-old might say, like, well, I fall off my bike a lot, but I don't do it on purpose. Okay, clearly this is not even on his radar, although he may be depressed, not on his radar. In teens, it might bring up self-injury. Self-injury is different from suicidal gestures. So, and again, you're gonna, if that stuff comes up, you're gonna be getting extra help, and we're gonna talk about that in a minute. But I don't want you to be afraid to ask either as parents, because again, we need to talk about it. Or a lot of times for kids and teens who are depressed, it's a lot more passive. It's sort of just a wish that something bad would happen, or a wish that, you know, I'd get kind of sick, not really sick, but have to be in the hospital for a while, or have an accident and have to be in a cast and stay home because it's just a reprieve, right? It's just a break from all of the stress and strain, and everybody who loves me is going to come around and help to take care of me. And when you're depressed and you don't feel like you can do for yourself, that's what you want most, is other people to do for you. And so it is a symptom of depression, that kind of passive, we call that passive suicidality. So sometimes just asking about that, like, you know, sometimes when people are really sad and depressed, or they've already been diagnosed with depression, when people are really depressed, they just kind of wish something would happen so that everybody they love would have to take care of them. Do you ever feel that way? And many kids who are depressed will say yes. And then we follow up on that as a psychologist or a psychiatrist. If your child is depressed in terms of suicidality, you want to keep a safe environment and monitor closely. It is not being paranoid to monitor prescription medications and things like that in the house if you have a kid who is depressed. And you want to check in often. You don't want to just ask once and the answer is no, so you never ask again. It's like with the little kid giving them broccoli, you keep giving them broccoli to make sure each time that they haven't changed their mind about broccoli. So check in often and keep asking. And if you ever have any immediate concern for their safety, you ask one of these questions and it brings forth a flood of emotion and a plan or, to hurt themselves, or they have gone that far to think about how they would do it, what they would do, when they would do any of those things. If there's any inkling of a plan, you're going to want to get immediate help for sure and go right to your nearest emergency room. And again, I think it's always helpful to know what to say. So you just say something like, you know, you're the most important person to me, and I don't feel like we can keep you safe at home right now. I couldn't live with myself if I let anything happen to you. We need more help. So, diagnosis and treatment, when and how to find and get help. What do you say if you think your child or teen might be depressed, or you're just worried about them? What do? The first step is to talk to them and get a little more information, but it can be hard to know what to say and where to start. So first, just find a quiet space and time. Use nice therapist posture. Have them turn off any screens and social media. Sit down and make yourself comfortable. Send with your body language the message that you're not in a hurry, you're not going anywhere. If it's going to take a little while for them to tell you what's on their mind, because it often does take kids and teens a little while to really tell you what they need to tell you, that you're not in a rush and you're not going anywhere. And that you're going to be okay with whatever they say. And tell them what you've noticed. What have you observed and why are you worried? You know, I've just noticed that you're spending a lot more time at home lately, and that, you know, you don't seem to be hanging out with Bethany anymore, and I know she was a great friend of yours, and I'm just a little bit worried, you know, that you seem kind of angry and irritable at home a lot of the time with your sister. That seems new too. Just seems like things are a little different. Is there something I need to know? What's going on? What have you observed, and why are you worried? Ask open-ended questions, right? You all know you're not going to go in there and say, are you depressed? That's not the way we're going to start. But you also want to just be really careful of not asking yes or no questions, but really trying to leave things open. I've noticed this. Here's what I'm concerned about. What do you think about that? Is the best way to go. And really not asking why. I think it's an easy pitfall for parents to look for an explanation or a reason why we're noticing a change in our kids. You know, assuming that she's not hanging out with Bethany because Bethany must have done something awful to her. You know, what's going on? Is Bethany being mean? What's going on with her? Well, that's a yes or no question, and you're assuming that you know what's going on. Or vice versa, I don't understand, what do you have to be depressed about, right? Everything seems to be going great. Why would you be depressed? You have everything you need. Well, that's the definition of actually clinical depression, is that there may be a trigger, but there doesn't have to be a reason why ongoing. And you can also sort of give some examples, if that would help. So, you know, if you're worried, if they're saying, well, I've just been kind of down, you know, well, I get that, you know, you seem kind of down, but you know, sometimes when people are feeling kind of down, they also just want to sleep all the time, or they're not able to focus as well as they used to be able to focus. And I'm kind of worried that maybe more is going on with you. Do you think more is going on with you? Another way to bring up suicidality too. Sometimes when people are really, really depressed, they just wish they would never wake up. And that's a comfortable way for kids too, because you're normalizing it. One of my first messages when I see kids and teens in the office is I try to find a way to tell them that they're not there because anybody thinks they're crazy. They're there because as a family you've decided you just need some more help and support. So by giving examples of a lot of times when other people feel this way, this happens, it normalizes it too and can make them feel less alone and less crazy. And reassure them, right? Because again, if they really are depressed, there's that hopelessness that things are never going to get better. You know, I'm really sad that you're feeling this way as your mom, but I know we can figure this out. We're going to figure out what you need to feel better and get back to doing the things that you need to do. But you also want to be clear and honest. You don't want to say like, well, I've made an appointment for you and we're going to go 3 o'clock on Tuesday. Well, what kind of appointment? Well, just an appointment. It's a doctor. No, you want to tell them that, you know, this is more than we can handle on our own. I'm here for you 100%. I'm going to do everything I can do, but I feel like we need more help as a family. So we're going to go see a doctor or a therapist who can help with your feelings. And validate and don't compare. This is also the place where if you do have a family history of depression, maybe you want to bring that up. That's a really personal decision when and how and if to bring it up, but there's certainly a high genetic component to this, and so it can again take away some of the blame for the child and for you as a parent too, or a grandparent, or a relative that you know, this isn't anything anybody did. It's not something you did wrong. It's just this happens. The same way people get diabetes, they get depression. It's okay. You don't necessarily want to compare to your own experience though, right? Like, well, when I was in college, I had you know, and this is what helped me, not at this stage, because you really want to validate how they're feeling. What do you do? Again, everything we know about depression started with adults and got extended down to teenagers and kids. There's still a wealth of research going on, including the medications, right? So many of the medications initially were prescribed off-label, and it's a lot of downward extension of what we know from adults. So the results are still a little bit mixed. The verdict is still out to some extent, but we do know that particularly some studies of what we consider treatment-resistant depression that didn't kind of respond immediately to medication or therapy, that the sooner we get in there and the more aggressive we are in treating depression, the better are the outcomes. So there are higher rates of remission, higher rates of getting better, and lower rates of relapse. If you treat depression, if you treat a first episode of major depression early and aggressively, there are less likely to be future episodes of major depression. If you don't, there are more likely to be. It's sort of like the way that I think about it is that there are roads, well-worn roads in your neural pathways in your brain being worn, and so if you let that episode of depression go on long and deep, then it's really, it's establishing that road, it's establishing that pathway, and it will be very easy to find it again and get on it again in the future. Whereas if you cut it off soon and kind of get in there quickly, then it's less likely to occur again in the future. So what do? First step is usually just a good idea to talk to your pediatrician and say, you know, I was concerned and we talked about it, and I'm still concerned, and this is what I'm noticing, and I feel like we need more help. And they can sometimes give you a referral Couple other routes you can go are, especially if you want to see a therapist or a psychiatrist who's in your health insurance network, call your health insurance company directly and ask them for a list of providers is a place to start. I think starting with a family member or a friend, another parent in a community that you're close with that you know who's had a good experience with somebody is always a good way to go. And then there are also some referring agencies that can give you ideas as well, and I'll give you some resources at the end for that too. It can be tough, I'm not pretending that it can't be tough. Wait lists are long and there aren't enough providers, even in Massachusetts where we have, I think, more psychiatrists than pretty much anywhere in the country. In terms of therapy, especially if you're really talking about depression, I would suggest asking for a cognitive behavioral therapist or somebody who has some experience or training in cognitive behavioral therapy. It does not have to be something like, we have the child CBT clinic here at MGH, which is fantastic. It doesn't have to be a CBT clinic necessarily, but somebody who has some experience in cognitive behavioral therapy. The basic tenet of cognitive behavioral therapy is what we call the cognitive triad. So you can picture a triangle where at the top here you have thoughts, down here you have feelings, over here you have behaviors, and they all influence one another. And so intervening at any point on that triangle, challenging those kinds of thoughts. I'm stupid, I'm just never going to do well in school, all my teachers hate me. Those are not helpful thoughts. Or the behaviors, the increasing withdrawal, the sleeping all the time, not getting exercise, or the feelings. The easiest way to change the feelings directly is medication, but we can intervene at any one of those points is the idea, and it will impact the other points as well. And so that's kind of the basic tenet of cognitive behavioral therapy, and then there are all kinds of skills and approaches. It's sort of the way I put it is we're giving you and your child a toolbox of things that you can use to try to cope better and to feel better. And you may want to consider medication, and we can talk more about that some. I'm a psychologist and not a psychiatrist, but a great resource for that also is a book written by the Chief of Child Psychiatry here, Tim Williams, wrote Straight Talk about psychiatric medications for kids. I think it's in a newer version now, an updated edition, and it's a great resource just if you have concerns and questions about treating kids with psychiatric medications. And things you can do at home. Encourage exercise. There's evidence, at least from adults, and again, the verdict is a little bit out on kids, but definitely in adults. We know there was a study where one group of depressed adults got exercise and placebo, exercise and medication alone. And the exercise and placebo group did just as well as the other groups, if not better. Exercise releases endorphins, it just regulates sleep, it does all kinds of good things for your body that can help to fight depression. Activity scheduling is a skill we do in CBT, where we come up with a list of pleasurable activities, things that at least used to be enjoyable, and we schedule them. We build them into the week to schedule them and make it a part of the plan that that's what we're going to do that week, and so you can help with that as well. The flip side of that is also reducing stress. Like I said, I do a lot of neuropsych assessment with kids where we're assessing all areas of functioning, and I often will say to parents, what adult do you know that we expect to be good at sports, have a billion friends, be smart in math and science and English and writing, know how to dress, and manage his time, and it would be great if he cooked and made all of his own meals and did his own laundry. I mean, what adult do we know who we expect to be expert and excellent in everything? Our kids are under a tremendous amount of pressure, at least many of them are, to be good in all things all the time, and that is not realistic. And many kids who experience depression also have a level of anxiety and perfectionism. And so if that characterizes your particular kid with depression, you really want to focus on reducing sources of stress as well. Monitoring social media use, I've alluded to this a couple of times. There is also research to suggest that the more time that kids spend on social media, the more depressed they are. And we don't know exactly why. It's probably multifactorial, lots of reasons why, but I firmly believe that at least one of those reasons is what I call FOMO. We all have FOMO, all teens have FOMO, fear of missing out. And social media plays into that like no other, right? All you're doing is watching and seeing what all your friends are doing without you when you're not with them, or how many friends liked that friend's picture and didn't like your picture on Instagram. It's just constant comparison to other people, and that just is not healthy for any of us. And some kids may be particularly vulnerable to that. I'm not saying it's a cause of depression, but if you have a kid who's already depressed, it certainly can be exacerbating, so you want to be conscious of that. You can also model problem solving and adaptive ways of thinking that kind of counter those hopeless, helpless statements of like nothing's ever going to get better. It's always going to be terrible, and I'll walk you through that in a second. Helping to establish a sleep schedule. Getting good sleep, we all know, is critical for kids and teens. One of the best ways to do that is to establish a consistent wake-up time and avoiding naps during the day. And there's all kinds of good resources on just what we call good sleep hygiene. If you just Google sleep hygiene, you can come up with all kinds of ideas. I know there was also, I think, a talk on sleep as part of this series you could go back and look at. Particularly in younger kids, I know we've been talking a lot about teenagers, but particularly in younger kids, building a feelings vocabulary. We have all kinds of big words we can use to describe how we feel. Kids have a more limited vocabulary. They may say, I'm frustrated, I'm mad, I'm sad, I'm happy, right? We may say, I'm feeling really content today, I'm feeling pleased today, or I'm feeling ecstatic today, or I'm feeling, annoyed as opposed to frustrated. I'm annoyed with this one person, but I'm not generally frustrated. I'm feeling irritable. I want to be alone. We have all kinds of words and descriptions for how we're feeling that make it more nuanced and less kind of pervasive and it's all the same. And so modeling those kinds of words and helping. You don't want to tell your child how they feel, but you want to say, how are you feeling? And I don't know. Like, well, it seems to me like maybe you're a little bit irritable, but I don't know. Just kind of playing around with it a little bit. And being careful to label behaviors, not your child. I'm noticing that you're just not getting your homework done the way that you always have. Seems like you've been really lazy lately, right? So one is you are lazy, the other is you are not doing something specific that I'm concerned about. So I mentioned modeling problem solving. This is one of my favorite things to do, especially I do this all the time with parents of kids with diabetes, for example. We use this little acronym to help you out called SOLVE, right? SOLVE, to model problem solving. So the S is for select a problem, the O, which often the problem selects itself for you. The O is for options, the L is for likely outcome, and you're choosing the very best one and evaluating how it goes. The most important piece here as a parent in modeling this for your kids is the options part. So, I did way back when I was part of a trial for treatment-resistant depression, and we did this often with kids. And so say the problem was, I've been depressed and my boyfriend broke up with me, and I'm devastated. I didn't want to break up, and he broke up with me, and I'm feeling awful. And I'm feeling so awful, even that I've thought about killing myself. So we would go through all the options and we would very clearly state, that's an option. It's always an option, it's absolutely an option. What are some other options? And you're coming up with options without deciding if it's a good option or a bad option. You're not evaluating the likely outcome yet, you're just brainstorming options. That's certainly an option. I can imagine that you're feeling that bad, that would come up as an option. Can you think of something else that's an option?